Hello, everyone. Hello, everyone. This is Adam Fishman, the Executive Director of American Friends of Likud, and I want to welcome all of you once again to our continuing AFL exclusive webinar briefing series. And we are very excited to have our very good friend with us, Maayan Jaffe-Hoffman. As usual, I'm going to ask you for any questions to please use the icon or the what it's called, the function on your screen there for Q&A. Type in your question. The Q&A is generally not for discussion. It is for questions only. And we will do our best, along with Sarah Beiser, our President Club member and board member who is going to be moderating. We will do our best to get as many of the questions answered as possible. As I said earlier, our discussion today is on the Delta variant, potential lockdowns, new restrictions, global implications of that. And I'm going to hand it over to Sarah to formally introduce Maayan, and then we'll get to Maayan's briefing and your questions. Sarah?
Maayan, hi, it's nice to see you today. Maayan is head of strategy for the Jerusalem Post group. And Maayan, maybe you can explain, because I think most people here don't know what the Jerusalem Post group is. And Maayan is senior analyst for former news editor and head of online content and strategy for jpost.com. And Maayan, I think I can say that Gil Hoffman is your husband. You are his wife. I don't want to prioritize. You are equally stellar journalists.
Thank you. Well, thank you so much for that introduction. That's so nice. But no, that is true. Head of strategy for the Jerusalem Post Group, to answer your question, is the Jerusalem Post Group is actually Ma'ariv, Walla, 103 Radio, Charlton Sports, and the Jerusalem Post. And so my role is to work on strategy now. You're sort of behind the scenes with all of that. But because I've been covering Corona for a year and a half, I haven't been able to stop that. So in addition to my regular role, I've moved into the role of senior analyst, health analyst, and specifically on coronavirus. And I'm still following it very, very closely and connected with the health ministry, the health officials, the hospitals, et cetera, as we unfortunately continue on this path. About, I don't know, a few months ago, as Israel was coming out of the pandemic, or so it seemed, Yaakov Katz, my editor-in-chief, and I were sitting around a conference room table in Tel Aviv having a meeting about, I don't know, something else with a few other people. And Yaakov made a joke and he said, well, coronavirus is over. This is great. We're all happy. We're without our masks. And he says, the only person in all of Israel who thinks the coronavirus is coming back is Maayan. And, ha, 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 everyone laughed. And I said, Yaakov, it's not only me. I believe that people understand that there are variants coming, but nobody wanted to hear it because we were all so excited as the restrictions got lifted. And, come June 1, as the Green Pass expired, Israel felt that we were really coming out of the pandemic. But just to back up a little bit, what we knew at the time is, well, Israel had vaccinated. We were the vaccination nation, and it was really incredible the way we were able to carry out this campaign and get 90% of our really at-risk population and 65% of the total eligible population, or total population, vaccinated, which was amazing. We also had to recognize that unfortunately, the rest of the world was not vaccinated. So Israel was sort of living here in this little bubble, and we'd really largely kept our skies closed. So it is true that internally, we really didn't have the virus. In fact, when they opened up vaccination to kids 12 to 15, we have several children, and a few of our children are between the ages of 12 and 15. And I was really grappling, my daughter had just turned 13. Should I even get her vaccinated? If she's not going to leave the country, does she need to get the shot? We sort of felt that things were fine. I did get her vaccinated, mostly because we thought that she would go and visit my parents. Potentially, we haven't seen them in 2 years, right, in the United States for the summer. But very soon after she got that second dose, we started to have some outbreaks happening at schools and other places, which stemmed from summer travel, right? The original, now it's a little different today, but the original variant, the Delta variant that came into the country, came from abroad. We know that the Delta variant started in India, it started to travel, and of course, it came to Israel like everywhere else. The Delta variant is, the Delta and the Lambda variant are the two dominant variants right now across the world, and they are unfortunately very vaccine resistant. So what that means is that it's not resistant against, I want to be very clear, resistance in terms of catching corona. People who are vaccinated and maybe 5-6 months ago, whose antibodies are waning, who might not have anyway as much protection, are more susceptible to contracting the variant, to contracting the virus. In addition, the virus, whereas the vaccine was 95% effective against even contracting the virus, in its original formation, against the Delta variant, it's gone down, to, we don't know exactly, but maybe around 60, to 70% in terms of contraction. And so we're seeing a lot of people who have maybe gotten the shots, and are fully vaccinated, getting the virus. However, the vaccine is still effective. Why do we really get vaccinated? We don't get vaccinated. What does it matter if you catch the virus other than you're maybe in isolation? You could share it with somebody who's not vaccinated. But if you don't get a serious infection and you don't, God forbid, die, then the vaccine is doing its job. And right now in Israel, though, we do have people with several underlying medical conditions, definitely over the age of 60 and above, who are getting hospitalized, even though they were vaccinated, probably more than 6 months ago in almost every case. And that is because we are starting to learn from lots of different research that the vaccine, unfortunately, after 5 or 6 months, really your antibodies do wane, and we'll talk about that third booster shot in a minute. And so people are catching the virus. But again, when you talk about who is really sick, who are serious patients, and actually one of our reporters tonight, Rosella, they sent out a report today from the health ministry, and these people, the people that are in serious condition, are old and have many underlying medical conditions if they were vaccinated. There are unvaccinated people in serious condition, of course, but the vaccinated people are not people that are not anyway going to be very immunocompromised before getting the virus. And again, possibly did not, or definitely did not, because we haven't gotten everybody, hadn't gotten that booster shot. Now, Israel made a decision about a week and a half ago, I'm trying to remember exactly when it was, to do something that the FDA did not approve yet. And we said, let's go ahead and give that third shot. That decision was based on research, mostly being done at Sheba Medical Center, our largest hospital here in Israel, always ranked in the top 10, where they were looking to see if antibodies wane. Now, they've been testing their medical staff, actually, plus a cohort of people over the age of 60 since December 20th, 2020, when vaccination started in this country. And they've been tracking them every 3 months to see the level of their antibodies. And what they were able to find was that the antibodies were in fact going down, and specifically in the older cohort. So what they are still found, and Maccabi just came out with yesterday, in fact, is that the younger population, let's say 12 to 15, the very young population who is recently vaccinated, also anyway, the vaccine seemed to be more effective in younger people, believe it or not. These people have 95% effectiveness. The vaccine is working. If a 12-year-old gets vaccinated, the vaccine will protect you against the Delta variant 100% almost. But if you're 60 years old and got your vaccine, or 80 years old and any range, and got your vaccine 5.5 months ago, you're much less likely to be fully protected against this new variant. So the Delta variant is spreading all over Israel. We started out, with a few hundred patients. It was going up. Today and the day before, we were well over 3,000 patients. We almost hit 4,000 a few days ago. And we're seeing a much higher percentage of people testing positive. The death rate is still lower. The serious patients are still lower percentage-wise, but they're not going to be for that much longer, and we're starting to know it. So that brings us to lockdown. So what's going to happen with lockdown? Naftali Bennett entered office and he said, no lockdown. Lockdown is for the weak. We can survive without lockdown. Today, he gave a briefing to the press. I listened in on it. People asked these questions. He answered my question, which we'll get to in a moment, regarding tourism, which is quite unfortunate. But he is really highly considering locking the country down over the holidays. There might not be a choice. Israel takes the virus very seriously, which is why we will be successful in combating this fourth wave. We don't allow the country to just completely open up if we think people are going to die or the hospitals are going to break down. And so we preempt that happening. In the third wave, we had a maximum number of 1,200 some odd serious patients in the hospitals. That was pushing the limit, but we had hired some new staff, some nurses and doctors to beef up our health system during that time, and we managed it. But we locked down when it was hitting those limits because we don't want people showing up at the hospitals and being turned away, not having a respirator or a ventilator, not being able to get maximum care. You might remember that at the beginning of the third wave, there was a 47-year-old father of 5 who died at Ichilov at Sorovsky Medical Center in Tel Aviv because his breathing tube, his oxygen tube had disconnected. It beeped and the staff needed to get there, but they were dealing with another serious patient at the time. And by the time they got there, it was too late. And that was tragic. And that really raised a red flag for the country that we cannot let the staff get overwhelmed. We don't want to be Italy. And so there is a possibility that with predictions being that we could hit 1,600 serious patients in the worst case scenario at Rosh Hashanah time, that we will lock down come the holidays. Keep in mind that the way the holidays fall this year, that we have about 9 real working days within the entire month of September. School supposedly starts on September 1st. You've got 3.5 days of school before Rosh Hashanah break. So there's not a lot going on in September. And when we talk about the economy and wanting to maintain the economy, if we are going to do a lockdown, that is the time to do it. To come out by September 27th when Sukkot ends and to go into October with many less patients. But it might not happen. So we don't know. We don't know what's going to happen. Why do we not know? Because of this idea of doing the booster shot. We decided that with the vaccine waning and the risk of too many serious patients, that we would encourage the cohort who's most vulnerable, but who is also most likely to listen to the government and to do what they're asking them to do, to show up and get a third shot. If this works, if the shots make these people that are getting vaccinated, and there have been Maccabi put out today, I forgot the number, but it was like a huge percentage. I want to say even close to 90% of the eligible Maccabi, people who are insured by Maccabi got the shot already. They signed up to do it. Bennett put out a charge to get these people vaccinated, these citizens vaccinated within 10 days. I think it will happen. And that within 7 to 10 days will tell us whether or not it works. And if it does work, that number of serious patients will go down, the hospitals will be okay, and we won't need to lock down. But the problem is, because it's not FDA approved or any approved, we only have the research we have and it's preliminary. So we don't know if it'll work. And there were 2 reasons that they were considering as to why they might not give that third shot. Number 1 was because Pfizer is working on a booster that will be more effective against all variants, hopefully. It's multi-targeted. Right now, the key protein that is being targeted by the Pfizer and Moderna vaccines is the spike protein, the S protein. But we know that the variants are now happening, not just on the S protein, but many proteins. And so this new booster is supposedly going to target more of the virus and be more effective, to handle if there are variants coming in. And now we don't know if the people who took this vaccine will not be eligible for that vaccine, in which case they might have less effective coverage in a few months' time. The other issue is we've done research, but we don't really know 100%, why these people are getting infected. Is it because the antibodies are declining, as we talked about, and therefore the vaccine is less effective and they need a boost of antibodies? Is it actually that the Delta variant is just really circumventing the vaccine? So even another shot of the vaccine will not help. And, is it specifically, older people, or are we going to start seeing younger serious patients? We actually don't know. And so we'll have to sort of watch and see, which is what we're doing. Israel, the startup nation, kind of assertive and medically right now during the pandemic, the first in all ways, made this decision, and many countries are starting to follow suit because it is a wise decision, we think, but we don't really know. So that is to be determined. And in terms of the global implications, and that ties really to your countries around the world, the United States for sure, and certainly any tourism between the two, right? The United States was labeled a red country come Tuesday at midnight. There will be a 7-day isolation period required for anybody traveling into Israel from the United States because it's a red country. and or an orange country, I'm sorry, we now call red countries banned country, and orange countries are the countries from which you are required 7 days minimum of isolation, and then you have your yellow countries. But come next week, there's going to be many more. 18 were added to the orange country list, again, beginning on Tuesday at midnight next week. And on Monday, we're expecting another announcement of several more countries that are going to fall under at least the orange category, if not the red category, meaning that Israelis are not even allowed to travel out to them and certainly not come in. Most of the world is becoming red because the Delta variant is highly contagious. There are, studies that are showing that you have 1,000% more viral load when you're infected with the Delta variant, meaning that you're much likely to infect others. Therefore, you're infecting more people more quickly, and it's a scary thing. Today, I asked Bennett, okay, well, when the last tourism minister, Orit Farkas-Shakon, was leaving office, she wanted to give sort of her last hurrah. It wasn't really approved, but she said, tourism, July 1st, we're going to let in vaccinated tourists. Very quickly, the new government comes in, they push it off to August 1st. Great. Well, on getting close to August 1st, they said, well, not really August 1st. A lot of variant going on, a lot of infection, not August 1st. Since then, sort of fallen off the table. So I asked Bennett today, tourism is about 2 to 3% of our GDP. Understandable. We're not so worried about it, despite the thousands of people out of work. We want the tourists to come in. We obviously want pro-Israel supporters to be here. We're all family, but they're not worried about it as much from an economic perspective. But there's a whole other aspect to tourism that we seem to be forgetting in this country, which is twofold. Number one, we're a country of olim. We're a country of people who immigrated to this country, meaning that all of their family members do not live in this country, or many of them. We're talking France, Russia, the United States, India, all over the world. People are living here in Israel with their family members somewhere else abroad. And what really struck me was last Thursday, Sharon Albright-Price, our head of public health, she was speaking in the Knesset, and she said that in, I think it was the last 3 weeks, 14,500 appeals to be able to go to the former Soviet Union. Now, why is that? Because of 900,000 Russians who live in this country who haven't seen their family in 2 years. Not to mention my own self, an American citizen who hasn't seen my own family in 2 years, and the many other Americans who have made Aliyah, and again, from all over the world. So not letting vaccinated tourists into the country actually means not letting our family members. Now, there's a workaround for first-degree relatives that have a reason. You're having a baby, you're getting married. Maybe you can get in, maybe if you applied 2 weeks before, if you fill out the form right, if the consulate answers you, you might get in. But it's not easy. And if all the stars don't align, you're not getting in. If you don't come with an organized tour group, you aren't getting in for sure if you don't have a first degree relative. Let's talk about grandparents. They're not first degree. They're not getting in. And this is going too long. What about the people who own property here, right? Who can't visit their own homes? They're not citizens, but they are residents in some capacity, right? They own home. They want to spend some of their time here. The pro-Israel community, the Jews and the Christians around the world who love Israel, whose relationship for Israel is so important to us, they can't get into the country. And Bennett told me today, no plan. We don't know. We're not sure. Too much variance. It's dangerous now. It's a risk we don't want to take. So it's something that we're not even really thinking about at this stage. So this is where we are, hoping that, again, the third booster shots, or the third shot, the second booster, will be effective. And in 2 weeks, we won't be in this situation. But right now, it's a little less optimistic than, my husband, the most optimistic man in Israel, would like to hear me talk about with all of you tonight. So,
Maayan, thank you. We have a lot of questions so far. Where do we start? The first question for me is antibodies. People get tested at, let's say, Asuta and Ichilov, and it appears that the standard, the tests, the numbers are different. And so if you compare a number from Asuta to Ichilov, it's apples to oranges. What do the numbers mean? If you come out of Ichilov with 2,200 and you come out of Asuta with 400, what does that mean?
look, I'll tell you two things. it could be the test. I would recommend retesting if you're getting that's a pretty big difference. It's not 2,200 and 2,000, right? So, I mean, what I would honestly say is there's something that needs to be checked there. But there's a couple of things with antibodies you have to remember. There's two things. There's neutralizing antibodies and there's T cells, okay? So there is an idea of memory of your immune system, and we just don't know yet whether or not that's effective. So it's actually possible that you could have waning neutralizing antibodies, which is what the serological test is checking, and still be protected against the virus, at least in some capacity of serious infection, which is actually what we think is happening, which is one of the reasons that some of these people, most of these people, the vast majority of people who have waning neutralizing antibodies are still not getting serious infection, right? When they get infected. That being said, serological tests are not the way to determine whether or not you need a booster shot. And this whole myth of,
yes.
I'll go and I'll call my DeVita Dome and I'll get a serological test and I'll decide if my antibodies are high enough. Should I get a test? It's not smart, because first of all, antibodies move around, right? It's not a consistent number, and it's not always, as you said, consistent on the test. And it's not the way to make a decision. The question should be, are you over the age of 60? Did you get your vaccination 5.5 months or more ago? And if so, you should get the booster shots. We need to vaccinate, and it's not going to hurt you. They're seeing already today, they were able to put out the side effects. It's not even existent. The only concern, as I said, is really what's going to happen if you need another vaccination, right? Like how many times do you need to vaccinate? But the mRNA, and I think this is really important for people to understand, and I think we've even talked about it before, this is not a new technology. People think this is like some experimental vaccine, but it's not. mRNA has existed for 30 years. We've been working on developments for cancer vaccines and many other kinds of uses for mRNA. And we haven't invested in it enough because it's very volatile. One of the reasons it's waning, and one of the reasons we haven't been able to use it, Pfizer, remember, is stored at this ungodly cold temperature. That's because mRNA, if it's in seconds, can be not viable. It can kind of dissolve, and it dissolves when it gets into you. So we have a lipid covering, remember, right? A way to get it into your system. If that doesn't work, if you inject mRNA into your arm, it's just going to do nothing, right? If it's not in this special coating, because it dissolves when it hits your blood. And so this is not DNA. This is not a piece of the virus. This is an mRNA replica. And it's not dangerous in any way. Now, long-term side effects, of course, we don't know, right? We've not done this. So I'm not going to tell you that this is foolproof, but the virus we're starting to see after a year and a half is really dangerous. People who get sick that have any underlying conditions, they die, or they have long COVID, or they're hospitalized for months on end. So, if your choice is, I'm over the age of 60, and not every, again, there's young people that maybe have different, young people, right, that have maybe some different considerations. But if you're over the age of 60 and you are dealing with the Delta variant, it would not be the smartest move not to get all the vaccinations that you could in order to protect yourself against catching that virus.
David Wallace. Okay.
Yeah, if I could just jump in.
David Wallace, actually. Okay. Go ahead, quick, go ahead.
Very quickly, the United States is beginning to mandate that people become vaccinated, albeit they're doing it in a roundabout fashion, but they're allowing companies to tell their employees that only vaccinated can continue employment. Disney and Walmart already started this. Jerry Platt, our president in New York, was asking, is Israel implementing similar mandates to effectively force people to vaccinate?
No. We will never force vaccination. But keep in mind, private companies are private companies, right? So there are certain companies here that did, even in the, even previously in the beginning of the vaccination, say that you couldn't come into work. If you weren't vaccinated, you had to work from home. There was a court case where a teacher who was an anti-vaxxer was high risk with some students, and they didn't let her. They said she had been allowed to teach from Zoom. They didn't fire her, but she wanted to go into school, and they wouldn't let her. And the court said she couldn't go into school. So that is going to happen here and there. The main thing that we're doing, as is the Green Pass. It's probably the purple ribbon will probably roll out again pretty soon. Putting some rules on businesses more or less in terms of numbers and things of that nature. That's very possible. But the Green Pass says that you cannot enter any gathering at all in a closed environment without either being vaccinated, mahlim recovered, or testing within the last 72 hours with a PCR test, or the last 24 hours with a rapid antigen test, and which don't really exist too much yet in the country, but they will actually in a few days. Next Sunday, they're supposed to have our rapid antigen test testing system roll out. And so, but like there are places like Checkpoint, for example, they don't allow their employees to fly abroad, and employees had to agree that they wouldn't fly. So there are companies that are doing things like that. And, you know, again, a private company is a private company. We sent out, I'll tell you at the Jerusalem Post, a mandate that you cannot come into work if you don't have a negative PCR test 72 hours before if you choose not to vaccinate. So you have to continually every 3 days get tested if you want to come to work.
So Maayan, David Wallace asked about the vitamin C sufficiency program to end deficiency. And what is the story with that? And
I'm not familiar with that program, the vitamin C deficiency or the vitamin
the
D
vitamin D, the vitamin D3.
Okay,
the vitamin D3.
Okay, so look, the truth of the matter is they've done a lot of research really since the very first wave of the pandemic into vitamin D and its impact on COVID. And we actually know now that people who are vitamin D deficient are more inclined to develop more serious conditions and even death. I don't remember the numbers right now, but after this call, I'm happy to send out links to articles. I've even written them myself about research that's been done that has shown that. And very recently, you know, they, as I said, they started in the first wave, and they thought, oh, there seems to be some link between people who are vitamin deficient and serious condition. But by, you know, a year later, they were actually able to capture this in a multi-center study here in Israel, for example, where they found that if you were vitamin D deficient ahead of catching the virus, that you were gosh, I don't want to give you percentages that are wrong, but you were a very high percentage, and again, I'll send you out the materials if you want, likely to develop serious disease and even death. And so there are programs going around to try to get people, you can easily fix vitamin D deficiency through supplementation. In fact, even though, you know, sunlight is obviously the most effective way, there are, and food is, like, you tend not to, what's the word? It doesn't dissolve. It doesn't absolve. I'm losing the word, but it doesn't
absorb.
Thank you. I'm like, I can't say the word. It doesn't tend to absorb the vitamin D when you eat it from food. So they actually recommend that you do take vitamin D as a supplement, and you can get that at any drugstore, and there are amounts per weight and per age that you should be taking. And you know, if you read about that, that is very highly recommended in terms of, again, not helping to prevent COVID. It's not like if I take vitamin D, I won't catch the virus. It's that it will help prevent serious.
Maayan, what is the thinking in Israel about having a Pfizer set of shots and then getting a J&J or Moderna? What's
Sure.
what about, you know, tacking on different companies?
Sure. So we actually sent out a health ministry policy about that last week as we get ready for third boosters. And of course, we have these 200,000 Moderna shots, right, that we've been storing and we hadn't been using while we were using Pfizer. And now Pfizer is coming, but we are going to have a little bit less Pfizer until, you know, we finish filling in our supply. We have enough Pfizer. Nobody's going to miss a vaccination, but people who are newly vaccinated right now are getting Moderna. The policy is like this. We prefer to give all of one vaccine. Research around the world is showing that it's okay to mix them. And in some cases, you know, like for example, in the UK, they found that in some cases it actually can improve prevention. In Israel, we have access to Pfizer and Moderna, which are very similar. They're mRNA vaccines. But Pfizer, they're saying if you took first and second shot Pfizer, they want you to get the third shot with Pfizer. If it is for some reason not available, they will allow you to get Moderna. The same thing with Moderna. If you're getting the first shot Moderna, they want you to get the second shot Moderna. If you got the first shot Pfizer, they don't want you to go and get second shot Moderna. Keep in mind that there's the main differences between these two vaccines is the quantity, how much you're getting. So you get 30 micrograms, I think it's called, of Pfizer, and you get 100 with Moderna. And also there's a different amount of time between the two. So it's 21 days for Pfizer and 28 days for Moderna. But by and large, they're very similar vaccines. Now, J&J and AstraZeneca are different kinds of vaccines. So what they did in the UK was they mixed, you know, people, they started out, remember, they only had access to AstraZeneca. So they vaccinated with AstraZeneca. And then as they started to get vaccines of other kinds, they gave the second shot, in some cases, with another vaccine, and they actually found it to be effective and not at all problematic. That being said, Israel's protocol is to not do that.
Okay, Isaac Glassman asks, are the decision makers in the health ministry working from models of spread and mortality? And without migration efforts, how many vaccinated people under the age of 72 do they expect would die from the Delta variant?
That is a question that I do not know the answer to. It was a little too
I
detailed.
know.
I'm sorry. But what I will tell you, in terms of our tarchishim, our predictions, what we do know is there's really kind of two schools of there's a group of people who are a little more pessimistic, who believe that, we're going to be hitting, like I said, the 1,600. And whereas we were seeing a lower percentage of people dying up until now, there is a school of thought that believes that it's, because it is true, we're seeing the percentage go up and up, that it's going to hit the same levels as first to third wave. There's another school that is watching what's happening in the UK, seeing how it's plateauing and believing that will happen in Israel, and that we're going to hold sort of around this, 2,000 to 4,000 new patients, and that we're going to start seeing a decline actually in serious and patients and death. We don't really know which one is going to be correct.
So I have an easier question for you from Leslie Botnick. When does Pfizer think that the new booster will be available? The new booster with an anti-Delta variant?
Yes,
content.
That is supposed to be ready and approved by the end of the year. So the hope is by December.
So would you recommend to someone who has no complications but still over the age of 60, would you recommend that they get the third shot, the booster now, or would you recommend that they wait? No question.
I'm not a health professional.
I know you're not a doctor.
But so I don't know that you should take my advice, but I will tell you what health professionals say,
Okay.
Rather than what I say, since I'm not the authority. But the health professionals in our country, and we actually spoke about it tonight even, say you should get the vaccine now, that the Delta variant is too contagious. And, we're waiting till the end of the year is a very, very big risk if you vaccinated 5.5 months ago over the age of 60.
I see. Avi Hauser asked, and I know you're not a politician either, but here goes. How do you compare this government and the previous governments in terms of decision-making and implementation of COVID-related policy?
Oh, that's so funny that you asked that. I actually wanted to go out with the deputy mayor tonight and did not write my analysis, so you'll have to wait till Sunday to read that because we had enough for the paper, my extra analysis. But I was actually going to write about this exact topic tonight, so I have a whole bullet points already written out of the differences between how they're handling it and the unfortunate scenario that Bennett is found himself in. So look, Netanyahu in the first wave, when it was a interim government, we all know he handles the coronavirus crisis incredibly well. Okay, we were the first country to understand we need to shut down our airport. We were the first country to lock down. We did, I would say, everything right. We built unity. We cheered on the hospitals. It was amazing, right? And then we came out of it way too fast. Why? Because the government transitions in May. And everybody said, wow, look at all these new ministers. We're so excited. You don't have to wear your mask in school anymore. And I'm going to make more trains and buses available. And here, let's expand the school day and all the kids can go back. And, everything just sort of opened up and opens up and opens up within 30 days of these people coming into office. We were opened up. And then, of course, what happened within 2 weeks of that time, we were in the beginnings of another crisis. We all know how that went with 2 subsequent lockdowns. Netanyahu gets credit for bringing these vaccines to Israel. And I think that with all the help of the health ministry, and Yuli Edelstein will tell you he did it, and this one will tell you he did, but we all know the 30 calls are true. He did talk to Burla, and he was very involved. Of course, there were professional considerations. Albert Burla is not a politician, and Albert Burla made his decision because the data that we had was extremely valuable. Now, here's Bennett sitting in the background of all this, kind of a rookie politician. I mean, he's been around for 10 years, but let's be honest, he didn't even make it into the government, a couple of elections ago. And, then he's in the opposition, and now he's, got his 7 that became 6 seats in this last election. And now here we are, prime minister. But in the background of these first, second, and third waves, from defense minister to sort of just being not even involved, Bennett wrote a book about Corona. He knows how to beat the pandemic. He built his actual career. He is prime minister largely today because he went from being a marginal, right wing, and honestly, people saw him this way, religious Zionist politician, again, 6, 7 seats, right? This is not a politician of the people. Netanyahu, just keep in mind the difference between the Likud number of seats and the Yamina number of seats, even in the last election, despite the fact that Bennett is prime minister today.
Maayan, I will not ask you in my next question who you vote for.
I actually won't answer that question.
Good. I will not ask you. Don't worry.
And it has nothing to do with what I'm saying now. This is just the reality in the grounds, right? And so Bennett built his whole career on COVID. What happened was when the government was struggling with COVID, because by the way, COVID is a pandemic, and it's all over the world, and every country is struggling with it in its own ways, and Israel is no different. And so, in all fairness to whatever you want to, again, say about any government, the pandemic is the pandemic. And this is actually you're going to sneak preview of what I'm going to write about, because Bennett came into office not knowing that the pandemic was even going to be an issue right on the table, because we thought, well, some people thought that we had left the pandemic behind. We didn't look at, Africa and India and all these other places around the world that were like having thousands of people die. We thought, look, Israel's good. We're in a bubble. Everything is good. So Bennett came in and he was going to pull this unity government together. Really, Lapid, of course, is behind all of this, right? He got this done. Bennett got his place on the pedestal. All is good. And within like a week, right, the pandemic, there's this outbreaks in the school and the pandemic comes. So Bennett, I got this. I wrote a book, How to Tackle COVID. So we think all is good. I said we're never going to shut down the country. Right? I believe that we can live alongside rapid testing. Everything will be fine. We keep going. 7 weeks it's been, right, until we make any restrictions, because we can live alongside the virus. Now, we're going to have to live alongside the virus. In that language, Bennett and his team are not wrong, because the pandemic is not going away. Flu didn't go away. There are many viruses in history that didn't go away. And eventually we are going to have to figure out how to live alongside this, because it's not going away. And we're not going to just shut down every year for the next 10 years because we have COVID. So we are going to have to figure that out. And he's correct. But the pandemic is actually not smarter. The pandemic is actually larger than Bennett. And so what's happening now? And by the way, there's several things. Number one, Israelis are Israelis. We don't follow rules. What do you mean you're going to tell me we opened up, we didn't put on masks, we all gathered, and now you're going to cancel my wedding in a month? No way, right? It's not going to happen. And so all the Israelis, they don't follow the rules. And Bennett seemed to think that he was somehow going to convince everyone to follow the rules. But guess what? Netanyahu didn't get him to follow the rules. And Bennett's also not getting them to follow the rules. So in terms of handling the public, there's no difference between the two. You can listen to the speeches. I actually spent, I don't know why I did this, but I spent several hours one night in the middle of the night listening to their speeches and just comparing the language just for the fun of it. And I was like, look, it's so similar. It's so funny, right? Because there's 3 ways to tackle this pandemic: masks, social distancing, now vaccinations is really 3.5, right? This is a new thing, and hygiene. Right? This is what we're going to have to learn, but Israelis don't do that. We're on top of each other. We hug, we kiss, good morning, I love you, and so they're not going to be able to do this very easily. So Bennett is now realizing the reality of his book and his premise of people will follow rules. It doesn't happen in Israel. When we also start thinking about, in fact, I probably have my bullet sitting here on a piece where I'm sitting, but what else are we encountering, right? The Delta variant. Bennett does not control the variants, right? So we have a vaccine, and the vaccine is awesome, and everybody, again, should get vaccinated. But there are still going to be variants. And so variants are going to come in, and you're not going to necessarily know whether or not the vaccine is going to work against them. And nobody can control that. Nobody just because you know about that COVID doesn't mean you're going to stop that variant. So he can encourage people to get vaccinated, and everyone can vaccinate, and variants are still going to come into the country. So he, in that sense, it's not whether Bennett's doing a good job or a bad job, it just exists. And, there are several other factors, like the fact that Bennett, the economy. So if the challenge that Bennett has that Netanyahu didn't have is that Bennett has kind of a volatile government in the sense that it could easily fall apart. They're actually doing a good job. The fact that they've got this unity government together is a miracle. And the fact that it's lasted and they passed a state budget is incredible. And I think that they should get kudos for what they managed to do. But the reality is we all know that if things changed in the Likud and we went to elections, for example, we are a right-wing country and we know who's going to get reelected, right? We know what the numbers are going to look like. Nothing has really changed. So Bennett is nervous about that. And by the way, Bennett joined a unity government. What does that mean? He won't get reelected. If this goes bad and we shut down the economy and everybody's out of work, Bennett's in real trouble because Bennett's constituency, all of these, again, religious Zionist constituency that was interested in voting for him, saw him join a government with Yair Lapid, Mansour Abbas. Again, I'm not knocking the government. Again, great. But who are Bennett's voters? They are not Mansour Abbas's voters. They are not Yair Lapid's voters. They might be Gideon Saar's, right? But there's a lot of Merav Michaeli. Look at our health minister, right? You got the head of Meretz in the health ministry. Just think about that and then think about what's next. So Bennett is very scared. So it's a different scenario, what Bennett is sitting in and managing versus Netanyahu in that sense, because Netanyahu had a very large constituency and Bennett doesn't have that. So every move he makes, he's like it's like a kid in the, I don't know, we say in the spotlight, what's the word I'm looking for? It's a deer in the headlights, whatever. He's scared. He's a totally scared politician because any wrong move could really, there's a clause, let me say though, there is a clause in the unity government that says that whoever overthrows the government, if it's like Lapid or Bennett, they can't run again. But so Bennett's not going to overthrow the government, but what if the government gets overthrown, right? So there's a real risk there. And if people aren't happy with him, it's not going to go well for him in the next round. So he's kind of stuck.
Maayan, I want to respond in one regard to something you said that Israelis don't obey rules. So that may be true. However, I can tell you that because of the new bidud restrictions coming in first on Monday, now on Wednesday, all flights as of a couple days ago on Sunday on United, totally booked. Totally booked. So everybody, that's right. Everybody that does want to follow the rules, instead of coming in on Tuesday or Wednesday or Thursday, they're coming in on Sunday. So that's actually interesting.
They're scared. Yeah, that is interesting. They're scared. They don't want to go in isolation, get tracked.
That's exactly right. A real interesting data point.
No, it's good, but the truth of the matter is 60% of the people who are supposed to be in isolation have been pretty much breaking isolation before the.
So I have one last question for you. In Tel Aviv, everybody walks around with their mask on their chin. Is there any medical, is there any science which says that you transmit Delta or COVID through your chin? Why else does everybody have it on their chin?
Because they don't have it on their mouth and their nose. Look, I work now 3 days a week in Tel Aviv, and I'll be honest, I have my own office and everything there, but I walk around the office with a mask because the fourth floor already has had COVID in this new wave, several people. And, each city has its own personality, right? Tel Avivians are free spirits in some way, and again, not real followers. So they wear their mask because you don't want to, when you go into the store, you don't want to get a ticket and have to pay money. But, if it's on your chin, you've got the mask. So
and maybe on your hand, maybe it's useful on your hand also. You can go like this.
Extremely effective, right?
I want to jump in here, and I want to thank you all. I want to thank you, Sarah. I want to thank you, Maayan. This has been enlightening and insightful and scary, to say the least. But I say that in the best. I mean that in the best way. So I want to thank you for joining us again tonight. I want to thank you, Sarah, for helping moderate. And we do look forward to seeing everyone. If not live, as it seems it's not going to be, we actually have or had a mission planned for October, shortly after the Chagim. It does not look like that's going to be happening, but we will continue to meet here in a virtual format on Zoom and on our webinars, and do our best to continue to engage with our opinion and decision makers and the leadership of Israel, such as our good friend Maayan Jaffe-Hoffman. Thank you, Maayan. Thank you, everyone, for joining us, and we look forward to seeing you all again soon. Stay safe. Thank you. Good night.
Thank you.